welcome to this month's video. You know, during the first year, babies grow and change so rapidly that the techniques that we use to put our babies to sleep are constantly changing. It's important to know where your baby is at developmentally so you can meet her where she is. So today I'm going to talk about what to expect as far as sleep goes during the first 6 weeks. Now, during this period, your baby actually sleeps most of the day. You're thinking, why then am I so sleep deprived? Babies actually sleep about 16 hours per day. Unfortunately, it's just not all bundled together at the same time, which is why we're so tired. Now, during the day, your baby will nap about every 1 to 2 hours. Sometimes she may fall asleep a little bit before that 1 hour mark. Rarely, she may be awake for a little longer than that 2 hour mark, but she will spend most of the day sleeping. When it comes to bedtime, research shows us that the ideal bedtime for babies and toddlers is between 7 and 8 p.m. It's a little different, however, for the newborn stage because babies are still adjusting to the outside world and they actually don't yet have a circadian rhythm, and so they'll be ready for bed between 9 and 11. The older your baby gets and the closer to that 6 weeks she gets, you want to make sure it's closer to that 9 o'clock time because after 6 weeks you're going to transition to the between 7 and 8 o'clock bedtime. Now, how we put our babies to sleep is a big topic, and the strategies that you use will vary depending on how old your baby is, but our ultimate goal is for you to be able to lay your baby down, drowsy but awake each night. Now you're thinking, I get my baby to sleep and I think she's totally zonked out and lay her down and she still wakes up. So there's no way I'm going to be able to put her down drowsy but awake. And you're right. During this first 6 weeks, many times babies will actually fall asleep while nursing or being bottle fed, but otherwise they do need to be soothed to sleep, and that's okay. You can, however, practice, give her some practice rather, going to bed drowsy but awake every few nights, just to let her have a little bit of practice at it. Now, your baby's tummy is very small. It starts off about the size of a dime and grows to be about the size of an egg by around 1 month, but it doesn't hold that much food, and so your baby needs to eat pretty frequently. And unfortunately, this is no different at nighttime. So your baby will wake up between every 3 to 4 hours during the night. So how you respond to her when she wakes up, it's very important that you respond promptly and consistently at this age. It makes her feel safe and secure, and when babies feel safe and secure with their environment and their parents, they actually cry less, they sleep longer, and they sleep more restfully. When you're trying to put your baby back to sleep during these nighttime wakings, you can rock her, soothe her, pat her. These are all things that are very comforting to your baby. Thanks for joining us today.